can see everything, and if it doesn't work, I'll just do my own recording another time and post it, okay? Like a little 15-minute job. Sorry, everybody. Clinics is really hard, and you run around a lot. 2 Chihuahuas, one with a burst open mammary mass. She's 16. As the dog panted, all of her lower teeth were just doing this. Like, if she'd let me, I could have just gone and taken out all, like, her molars, her carnassials on the lower side. It was wild. Never met the dog before. No money. That's okay. We're going to get the dog fixed up. Okay, so I'm marking medical records, and this little hour session was to just go over things. So at any point, if you have questions, just shout out whatever, especially if I don't see your hand. So you get this medical record template, and this is a template that you will get used to when you're in 4th year, or there'd be something similar if you're out in small animal private practice. Many of you might be doing a job that's not in small animal private practice, so you know, if it doesn't apply to you, too bad. You have to get used to using it a little bit. And so up here, we want to make sure that you do fill in something. It's nice to have your team number there and everybody's names. Not every animal that you see is going to have an animal ID. You could leave it blank. You have species, breed, sex, and color. Those are pretty self-explanatory. Now, we have talked about, it's in your rubric, about a signalment statement. And a signalment statement basically says, who is your patient and why are they here? And this is going to be important in 4th year, because if you go to your clinician and just say, yeah, Fluffy's cough came back and now they want to try this, I'm like, that doesn't tell me a lot. You need to kind of reset your clinician's brain or your technician or your classmate or whatever. So being able to say, Blackie is a 3-year-old male neutered German Shepherd cross who's coming to the AVC today for a recheck on a cough. That would be kind of the minimum. Now, I know your signalment statement for your patients in junior surgery is pretty, boring, right? There's not a lot of stuff. And I know that all of the information is already here. But it would be really nice if somewhere, either in your assessment, you could even just put it right here. Like, it doesn't really matter. But this is a nice place, too. Now, a lot of people might say, well, chief complaint is here for a spay or here for a neuter or whatever. But to actually say, Blackie is a 3-year-old, I'll say intact, male, what are we going to say, like lab cross. I'll be even formal. You don't have to be this formal. Presenting, or you can just say here at ABC, presenting to ABC for a castration. Okay, so that's a nice signalment statement, and I would love to see that somewhere. If you put it down in your first assessment, and you don't have to repeat it every time, but if you put it somewhere near the top, that's pretty helpful. Just a note that where it says history, this is all history. This is stuff that's happened to your animal before it came to see you. So a lot of the stuff, you're not, there either isn't a presenting problem, like it's probably a healthy animal, but if you just leave it blank, I don't know if you even thought about it, right? So you could say, you could repeat yourself and say here for castration, or you could say none known, unknown, no illness known, anything like that, okay? Now, past history, again, if this is a cat action team cat, Humane Society dog, you're not going to know a lot. But if you don't put anything, I don't know. So unknown would be great here. Maybe there is a couple of things. Diet, you probably don't know what the animal ate beforehand. If you wanted to put a statement about what they're going to eat while they're here, that's okay. I know that's dealing more with the present and not the past. And you don't have to put that. You could just put unknown. Okay, so this is where people get a little bit caught up often. In the system review, a lot of people might start putting some of their physical exam, even if it's hands-off stuff. Even like if you put, BAR, ate some treats, poop in the carrier, stuff like that's all kind of present stuff, right? It's not really dealing with the past. So there isn't much that you can do without an owner present to ask about the past here. If you happen to have an animal from the Humane Society where they did just do a physical exam and for some reason it's coming to you, like maybe the dog had some skin lesions or something like that, you for sure can put a past physical exam finding into here. So you could maybe say no known problems with appetite, water intake, history, seems fine. Prince Edward Island Humane Society, PEIHS, noted some abrasions and hair loss around the face and in the forepaws, right? So that's more history. You could say things like that here. Any questions on that? Okay, so now we're into your SOAP. So when I went to vet school, we called it a DAP, a DAP. And all of your subjective and objective was just data. We didn't separate them. But that might help. Your subjective and your objective, those are both different kinds of data. So these are things that we're going to say about the animal that you're going to gather. And the easiest way of figuring out where things should go is your subjective is supposed to be all of the data that you can gain without actually laying hands on the animal. Okay? So you would want to talk about present attitude. They're BAR, they're spicy, they're swatting at the cage. You could make those kinds of observations. If you felt they were very thin visually, you could note that. The hair coat is unkempt. There's blood on the nose. One eye is squinting. There seems to be discharge from the nose and the eyes. The dog is rubbing its face. The cat is shaking its head and scratching its. You could say those sorts of things. But mostly it's just they appear to be QAR in their kennel. And that's it. That's all you have to say. Now we're moving into our physical exam, which is where we have our objective data. Okay, so your first exam, generally it would be pretty good to have some detail. Now you're not going to do an entire cranial nerve exam or a full neuro exam or an orthopedic exam, okay? So I don't expect that, but a nice full PE, if the animal will allow it, okay, would be great. So if you're putting a lot of within normal limits here, I'm like, great, I get it, it's within normal limits, but for like integumentary, you might put, you could put no abnormal findings, NAF or WNL, but then maybe you'd say hair coat is fine, no skin lesions noted, skin seems good, or whatever, or mild dandruff over the dorsum, or something like that. So maybe a little bit of detail that shows you looked at that in detail. And then on subsequent physical exams, you could drop all of that and just put within normal limits or no abnormal findings, okay? So weight and body condition scores all there, great. Any questions about these? So again, nervous, maybe you just put no abnormalities noted, full neuro exam not done. That's fine. If your animal is not allowing any of this, you would just note not examined or not able to examine, and you'd maybe explain that a little bit more in the subjective, like this animal is exhibiting signs of fear aggression, we're not really able to get near it right now, we'll try to do a better physical exam later. Or if you're leaving it blank, well, don't leave it blank. Put something like not able to assess, right? That would be great. So assessment, a lot of times I'm seeing people just list the problems. And assessment is more than just a problem list. I'm going to back up to a paragraph I should have said at the very beginning. Everybody does these differently. So I think a lot of what I say is not going to be, terribly wrong, but I might stress certain areas where when you get to fourth year and you're on internal medicine, they might say, I need you to do it this way. And if you said, well, we were taught in junior surgery like this, they're going to say, I don't care, I want it like this. And that's okay. You go to work in private practice, they're going to have a totally different form. They're going to stress other things, okay? So this is just so we can kind of all be on the same page, because I realize that when you start, you have no idea what's expected of you. I think you get a lecture maybe on medical records, some point, and maybe all of this is going to be repetition. I don't know. I wasn't there. But an assessment, it would be helpful if you gave an overall statement of how your animal was doing. So I don't care what order it's in. You could start off with Blackie is you don't have blood work yet or anything, right? So you could say, hard to read this, presumed normal canine who is healthy for surgery. Okay? And then, sorry about the little typos, you guys will forgive me. and then maybe you did note some minor problems. And I think an animal with minor problems could still be deemed healthy, right? Like if you just tell me problems, I'm going to be like, so are we going ahead? Are we sending this animal? Like, I want to know if you think even with problems, this animal's okay to go forward, right? So for problems, and I'm sorry, I know there's probably a proper way that you know better than I do to list them, like A, B, C, or whatever. But let's just say you maybe type problem list, and then you say mildly anxious. What would be maybe another problem, that mild problem that a dog might have? An ear infection? Sure, yeah, good. So we don't know yet if it's an ear infection, like that's more a conclusion, but let's say up in our physical exam, and maybe I should have gone through that and filled that in, but I think you guys can imagine maybe what it would say. You could put maybe debris in left ear, or even to be more specific than that, we could say, how about brown, how do you spell odorous, like that? Odorous debris in left ear, holding ear down, we could say mildly, red. Okay, so these are problems that were noted. It is also kind of data, but we maybe on our first problem list, we don't want to go to conclusions quite right away. So this is, if you put otitis here, that would be okay. I mean, you've jumped from your exam to the thing, right? But we don't really know. You could, because you're observing, yes, there's inflammation in the ear, but if you said ear infection, I might be like, do you know there's Easter bacteria in there? Like, is it how, whatever. So a third problem that a dog might have. What's that? Tartar. Oh, good job. Okay, so, and again, if you jump to say mild dental disease, I think that's reasonable, okay? You just don't want to jump to something like, I don't know, like if you said liver failure or something like that. Oh, you don't even have blood work yet or whatever. So you could say, how about mild tartar on upper premolars, some gingivitis. Ooh, okay. Yell if there's bad things, okay? Okay, so you also could come up with maybe some differentials for this, right? So you don't have to do it like this. Maybe your differentials are in your problem list, but if you did anxiety, possible otitis, mild periodontal disease, something like that, that would be fine. That's great. This will be really helpful when somebody's reading this record, and particularly if it's an animal that's coming that's sick. You would want to list your problems, and then, yes, you could move on to assess them, but you don't want to make any conclusions about true diagnoses if you don't have the data that you need, if that makes sense. Yes? Right, so if you mean like for musculoskeletal that you put not examined, you could say like moving normally or something like that. Does that make sense? And then in assessment, you could either under here, like maybe the dog is so anxious that you can't, okay, so you could be like full exam not possible due to anxiety, we'll try again in evening, something like that. So if you put it right in the exam, that's fine, although that would get a lot of words, so just not examined. Whatever you can tell, you could put down. And if I'm like, oh, moving normally, that should be in a subjective, that, no, it's fine, whatever, just some data that says you're trying your best to assess these things. If you put this in the problem list, like mildly anxious, therefore full exam not able to be done, we'll try again. That's also fine. A lot of times with cats, maybe you can't get a heart rate right away. Rest rate, maybe they're crouched in their carrier really in dark, and you don't want to maybe drag them out right now. You can. Oh, anytime you're estimating something, just put estimate. You know, I estimate the rest rate is in this range or whatever, or they're sniffing or whatever. Sorry, this is a tangent. Sometimes an animal won't be still enough for a heart rate. You can't do a full auscultation of the heart. I get it, no problem. Maybe you're not even going to be able to get one until they're sedated even. But if you can get a pulse, even if you're not having time, I love how I always demonstrate on my own body. Look at me grab my groin. If you're getting an ephemeral pulse, even if you are not able to feel it and be looking at a clock for 15 seconds, if you feel a dog's pulse and you go, okay, I can feel duh, 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 and the dog's gone, can you then go, okay, it was duh, okay, so I just looked for 6 seconds and I went bump, bump, bump in my head, and I got, so this is estimated, okay? It's not like a big count, but you could say, palpated pulse estimated heart rate of 100 BPM, because I counted 10 in 6 seconds. Later, right, if you can get kind of a bit of a tempo, you can take that away, hold it in your head, and you don't have to keep trying, like, hold still, well, I do this over 15 seconds or whatever. Any other questions? Okay, so we've got an assessment statement, and if your signal statement was part of this, or you repeated it, or you didn't put it up top and you put it here instead, fine. But on this first part of the visit, that signal statement should be present. Yes.
Going back to like the differentials and problem list, if myelocytis was included in the history provided by like the referring veterinarian, would that include that in the problem list definitively?
Yes, because this is a historical problem that you know of. Yes, absolutely. Great question. Or lameness that you don't see but that was noted before or something. Or if you're like, oh, they said this dog was lame but I'm not seeing it, you could put it in the problem list but say not observed today. Maybe it's an intermittent lameness or something like that. And then if you never observe it, maybe that's a problem that we drop later, right? Okay, so you may have some problems, you may not. A big overarching statement is that, can you see that if I was coming to this later and you had 14 paragraphs here in full sentences, it's really hard for the person reading it. And I'm not talking about me reading your junior surgery cases. I'm talking about when you do it in 4th year and then 2 years later the animal's coming back to see me for like itchy skin, and I'm trying to read through your visit from 2 years ago and it's got a lot of words. So point form is your friend. I love it if you can write properly and spell things correctly, especially because these have good spell checks. So if you're leaving a ton of red underlined words and not looking at them, I'm like, this doesn't seem like you cared to make those corrections. So I love if you're using good grammar and syntax and spelling things, but you don't need to write in paragraphs and full sentences, right? And you need to, I don't want you to leave anything out. You need to be complete and succinct. You need to really distill your information and say what the important stuff is, but don't leave important things out. Okay, so stop me anytime. So plan. A lot of times people will put that they're going to do an ear swab and do cytology, that they're going to talk to the shelter and recommend a dental, that they're going to put the animal on an anti-anxiety medication, and that tomorrow we're going to do blood work. What's the main reason the dog is here? Remember? Yeah. So always in your plan, please state the main reason the animal is here. You don't want to lose that. Again, if I'm looking through your records from past years, I want to keep track of what are we doing here? We're castrating this dog, okay? So under plan, again, I've made a note up here. The plan should include what you're doing for the next 24 to 48 hours and always should include the main reason. So plan, we're going to castrate on Thursday at lab or in morning or whatever. Okay, so we're going to be draw blood for pre-anesthetic check. We're going to recommend, or we could say a full oral exam under GA. I mean, I know that's later on, but at least you're addressing the problems. Now, I know also in plan, a lot of times when people are numbering the problems, then they want, if they have like A1, A2, A3, then they want to have a plan, P1, P2, P3, and match everything up. And some people, when you go to fourth year, may want that as well. As long as you're addressing what you think we could do for these problems, I don't necessarily need to see them. Like, I can figure it out. You listed 3 problems, and you're giving some suggestions of what you'd like to do for those problems in an ideal world, okay? So sometimes, though, you might have a problem where it's really nothing that we're going to do anything about, and then you're listing plans that aren't really very realistic. So if you wanted to say, I mean, I can't really think of an example. Maybe you, like if the dog came with a history of some kind of really weird behavioral thing, you're not going to start doing like full-on training or something, so that's not really a great example, because at least you could say we'd recommend a behavior consultation or something like that. But then you can possibly leave that. You don't have to keep repeating these things over and over. So I addressed, he's here for castration, so I'm saying the plan is to castrate. Because we're castrating, we're going to have to draw blood. If I did want to put them in order, the next one was anxiety. So how about like discuss anti-anxiety medication with Dr. Landry. The next thing was the ears, I think. And so we could say ear swab and cytology. And maybe if you planned on doing that under GA, you could as well. So I've made a plan that did in this example, address all of the things we noted as problems, and also said the main, you don't have to bold it, but the main reason that the animal's here, okay? Great. And signing it. Okay. In an addendum, a lot of times people are putting their addendum here. Okay? I don't care if your signature's ahead of the addendum, but please put the addendum here. Put the time at the top. Because I want to know, okay, addendum, it was 2 p.m. and this was noted, okay? If you make it, again, back to your succinct part, if your addendum is this long, and then I have to see when it was, that's hard for me to get the story of your animal in my head. So it's a small point, but try to do the time first. If you want to do time and signature first, I don't care. It's fine for me to note who did this addendum, who wrote this up, who was there at the end. That's okay. So in your addendum, on your first day, if you didn't get a full exam at first and you had to go to class, maybe it is an afternoon addendum, or if it's a dog that you walked, maybe you're doing that. But maybe it's not until 8 o'clock at night and you're doing an evening check. So you put everything that you need here. And if you are starting the animal on drugs, we would want to have the full drug information somewhere. So there are announcements that kind of deal with this. But I'll do it here. We want the name. We want the strength. We want the form. And I'll just do it like that. Okay. Okay. Then we want some kind of dose. Ideally, you might be doing like the actual mg per kg dose. Okay, but then we would want to also have the dose amount. How much is that? Then we would want to have the route. And if these are a little out of order, that's okay. But sometimes it's like gabapentin, PO, give twice a day, 1 capsule. And if we all do it in the same order, it becomes really easy. Or you might be like, twice a day, give 1 capsule of gabapentin, 100 milligrams. And it's really a lot easier if we know what it is, how it's coming, how much are you giving, how are you giving it, how often, and for how long. So the final things would be dosing interval and then duration of treatment. When you get to 4th year, there are prescription slips, like actual papers, and it lists all of this. And so it's very helpful when you're even if your vet is just typing it in RxWorks, it's very good practice for you to take a prescription and be like, okay, I know it's already done. The animal went home, but it's very good practice for you to write out a prescription, because when you're recording it in the medical record, when you're out on your own, if you're in practice, whether it's large or small, this is important, and again, really good to know completely what was done for the animal. So this is a weird pet peeve of mine because I managed the dispensary here for many, many years. So I'm the one who was reading all of those prescriptions and going, they don't say how long they want this for or what the form is. Okay, and it's good to know what the form is. So if you're saying that you're giving the cat a gabapentin tablet, I'm going to say, I don't think you have access to gabapentin tablets for cats unless Dr. Landry had some compounded or something. Okay, it's going to be a capsule. And it makes a difference. If you're writing a prescription for your technician to go and fill, and they're desperately looking for a tablet on the shelf, but really it's a capsule, and they don't know, they don't want to make a mistake, this is going to waste time for them to be looking for something that doesn't exist and then coming to find you to clarify, right? So being precise. Okay, so now we talked about being complete, succinct, and very precise. So an example for our plan, we could say, you don't even have to do this, but for anxiety, give patient. You don't have to capitalize it. Gabapentin. Okay, so I don't know how much Blackie weighs, but let's say we're going to give Blackie 300 milligrams, of gabapentin, and then you have 600 milligram tablets. So you can go back and correct these. If you don't know, you can just put, we're going to give gabapentin prescription to follow, right? You could do that. You're going to find out 3,000, did I put? Is it? Sorry. Thank you. Say that. Well, I had a dog going on 1,800 the other day, and it was described as a baby dose, that we could even go higher. So 300 milligrams, and then in brackets or whatever, we could say, let's do it in brackets, half. So you could do it that way. I'm also going to say that you could do it this way. Gabapentin, 600 milligram tablets. So that's what it is, okay? Give 1/2 tablet, 300 milligrams. This second way, I might even prefer, okay? Because you're naming the object of what it is. So the person who goes to look for it is going to know I'm looking for 600 milligram tablets, and then I'm going to give a half tablet, which is equal to 300 milligrams. Let's say Blackie is 10 kilos, so then you could say dose is 10 mgs per kg. You've already said it's 300 milligrams. Now, I know that in our cats, we're just giving half a capsule or a full capsule. And so if you want to the first time, you don't have to do it every time, doing the back math, right? If your animal is 3.5 kilos and you're giving 100 milligrams, just doing the back math to be like that is 31 mg per kg or whatever it is, okay, is helpful. Okay, so we're going to do this, then we can say PO every 12 hours for duration of stay at AVC, or until you make a change. Okay, or maybe the animal has already been diagnosed with some anxiety and it came with gabapentin from the Humane Society and is going to be on it for longer. So you could say as directed or whatever, but at least it's staying for the duration of stay at AVC or until you make a change. Any questions about that? And sorry, this was give patient, but So I didn't finish this one. This would be 300 milligrams, half tablet, 600. That would be okay. PO every 12 hours for duration. Maybe this time you don't want to do it for duration, for next 3 days. Okay. And then when you're doing a prescription at AVC or in private practice, you'd actually have to calculate that out. So if it's going to be on it for 3 days, and yes, you could even say starting tonight. Okay, so let's say it's going to need 6 doses in private practice or at AVC. There's going to be a place, where you're going to put, this is how many tablets you need, or that's going to be how much you're pulling out of Cubex or whatever. Yes?
What are your preferences for brands like Paper, Cuba,
Oh. Yeah, for sure. So this is again a little nitpicky. If you're using a brand name like Medicam, like Onsior, it should be capitalized. If you're using a drug name, it does not have to be capitalized. Now, I did because it's at the start of a sentence. But if I was in my addendum and I said, gave patient gabapentin, I would say that. Gave patient gabapentin, PO, 8 p.m. in small meat ball of canned food. Something like that, okay? So I don't have to use a capital there. Now, you when you are getting your meloxicam, it is all Medicam, unless we have a change and we have some generic. If you're giving your Onsior, it's all Onsior. Gabapentin, we have Tiva and we have Apo, depending on the size that you have. So if you have an actual bottle that it says that and you include it, no problem. You don't have to, though, especially not with generics. And if you never use the word Medicam and always say meloxicam, I'm not going to say, I need to know what brand it was, or something like that. Okay? Yep.
So, if you're recommending a drug in your plan, you do the name strength form, in your plan?
Or just when you give it, is that what you mean? Yeah, okay, so at some point you are planning to give it, right? So if in your first plan you aren't planning on giving it, let's say this is not an anxious animal and it's a dog and you have no plans, obviously it doesn't show up in your plan. If you are planning, it would be nice if you did the full prescription, if you know it. If you're more like, I think we need gabapentin, you can put plan to give gabapentin for anxiety, and then sometime before the first time it's given, either at the time you're giving it or before that, you need to say the full prescription information. So if I've got 3 entries where you're giving this animal gabapentin and you're just saying gave half a capsule, and I don't know what strength it is or how often you plan on giving it or for how long, and then all of a sudden there's a full prescription, I'm going to be like, okay, at least you got there eventually. But so if you didn't know the information or just thought maybe this is an idea, you could have this in your plan, right? And then when you go to give it, let's say this addendum is at 8 p.m. and now you've got the drugs and you're all set to go and you want to have something that looks like this. It can be in a fuller sentence if you wish, but with all that information, yes?
Do we need to make a separate addendum for a communication? Like if I went to Dr. Landry and discussed with her about how much gabapentin to put the cat on, do I need to make addendum 8 p.m. spoke with Dr. Landry and to give gabapentin
Right.
and then make another one later when I actually give it?
No, great question. You certainly can if you wish to. Every time you make an addendum, I would be looking for what has happened that's important between the last entry and when you're now doing the addendum. So if you talk to Dr. Landry at 2 and get your plan straight, you don't have to make an addendum that says 2 or 3 or whatever. At 8 o'clock when you're giving it, you could say, spoke with Dr. Landry this afternoon, okayed to give gabapentin 100 milligram capsules, give half a capsule by mouth mixed with wet food, Q 12 hours for duration of stay. Okay, and so that's the first time only. You do not have to do this full prescription information every time you're giving the gabapentin to the cat. Okay, so you can't just say 7 a.m. gave meds, though. So on day 2, when you're giving the gabapentin, you could say gave gabapentin 100 milligrams, half capsule by mouth. You don't have to. We already know what the plan is. That's already the prescription. You're making a prescription by saying this full thing, and then you're just basically kind of almost saying what's on your flow sheet in your record to say that it was done. Another thing that gets me sometimes is people go ahead, like it's only 4 o'clock and somebody's filled out all the next day on what they're planning to do. Sometimes what they do is highlight it, kind of like a draft. And you can do that. That gets a little messy because then I'm like, you got a crystal ball looking in the future? Like, I don't know. I mean, as long as you make it very clear that that's a draft, and then once it's done, right? Other times people do things with check boxes, and then I'm like, well, are you just listing what you think you might do, and then you're going to come oh, you know what people do? Sometimes people do a list, and then when it's done, they do strike through. And I'm like, does that mean you decided not to do it? Or does that mean you did it and it's done? So no strike through unless it's clear. Like if you did a thing and then you're like strike through and then we elected not to do this thing, right? That's cool because maybe you want it noted that you did plan to do it, right? But then we've changed our minds. That's okay. But if you've done something, you either write it or you write it with a checkbox. People get fancy. Or done, something to note that it's done. If it's there, I'm going to assume it's done unless you clearly indicate this is just what we're planning this afternoon to do. I get trying to be prepared, but that's taking it a little extreme, only in my opinion. Anyway, all right, is that good? Okay, so this would be the first time you either plan the prescription or that you're giving the drug, and then you could say you gave it. Okay, if this was all in day 1 and now this part is in day 2, you would probably want to say gave gabapentin, and you could go like half capsule of 100 milligram or 100 milligram capsule gave half. If you say 50 milligrams, I'm not going to dock points. I know what you've been planning. But if you just, right from the start, just say 50 milligrams of gabapentin, I'm like, if I'm a technician trying to do your order and I'm running around looking for 50 milligrams of gabapentin, not understanding that I need to split a 100 milligram capsule, that's not full instructions. So again, in your addendums, when you're giving it repeatedly, it's nice to say how much you gave. If you just say 50 milligrams, I'm fine with that because you told me what the plan was up above, right? Okay, so full information the first time and then do your best. Great. So if you have a bunch of addendums that you don't use, it's kind of sloppy not to delete them, right? Why have blank addendums sitting there? So if you only have one addendum for the night, we would be deleting this. I'm getting very close to the end. Okay, so oftentimes you do the date and time, but if your animal, sometimes we used to have them coming in on Monday and staying till Friday, and you have your medical records, sometimes they're like 42 pages long, okay? It's a big document. And if I'm going through and wanting to go back and check on something, like, did they say this? Like, I want to check on something. It could be really helpful. I don't know, what's next? Let's see, 4, 11, 12, 13. Next Monday is January the 13th. Is there live labs next week? So like on the 14th, you would have animals coming in. Let's say it's the 15th. Okay, so Jan 15th, 2025. You're getting them. It's 12 o'clock. Oh, sorry, this is the morning of your second day, right? Because you got them on the 14th. Jan 15th, so let's say... 700 hours or whatever. Day 2. This is day 2 of the visit. It's really helpful. You don't have to do it. I'm not going to dock marks or something like that, but that's really helpful to know where are we in this visit. If I can go to the top of the page. And you don't have to do it on all the addendums. No. I just mean, can we just where this line is? If I'm looking for the line of what day are we on, that's nice. I guess I was, second full exam, you can totally keep it short. You can now go to within normal limits, no abnormal findings or whatever. If you have detailed stuff in your first day and it's obvious that you cut and pasted it, that to me means I'm not sure that you actually really assessed that a second time. If it's something complicated, I can understand why you would want to cut and paste. So, there's no black and white here. But if it's super normal stuff where you could have just said, like, no change since yesterday, or no abnormal findings, or like, see day 1 exam, and instead you've put this paragraph about this really detailed thing that you found in their eye. And I'm like, did you really look at it again and saw all that stuff? Like, tell me something different so that I know that you're trying. Because mistakes can really happen with cutting and pasting too. Okay, a lot less detailed. I think that might be almost it. So again, to reiterate the plan, now you're advancing. So now we're going to have, I'll talk about blood draw, and that'll probably be the last thing. So now let's say we're on Wednesday morning and you'd be wanting to talk about we're going to draw blood, then we're going to interpret the results, we're going to do NPO overnight, We plan on castrating on Thursday. Maybe on Wednesday you even advance out to Friday. Plan to discharge on Friday morning. Okay? Sometimes in the morning of day 2, when you're taking blood really early, all your blood stuff happens as part of this morning soap. That's fine. Or if you're doing the blood draw a little later, it's totally fine to say, we did the morning soap and we plan on taking blood, and then maybe you have an addendum that says 8 a.m. and you describe the blood draw. So I need to, there is blood draw information. If you say you plan to draw blood and then you're coming with your blood work interpretation, it's a small thing, but we prefer to say we attempted to take blood from the right medial saphenous on this cat, vein blue, move to the left. Did I say right just now? Move to the left. 1 millimeter of blood was obtained and split between purple mini Vectainer and a red top tube, sent for blood cell counts and surgery panel. Okay, so it'd be nice to know what tests you're running on it, what you got. You don't have to be super deep, placed alcohol over vein or whatever. If you're doing like EMLA and wrapping and stuff like that, I don't know if that's going to be allowed this year or not, but you would want to describe anything that you're doing to the animal there. So whether that's part of your morning soap, if you describe it, but then it's like if you're saying 7 a.m. and here's your morning soap, but the blood draw happened at 8:30, to me, I'm like, why wouldn't you just do an addendum for 8:30? Because you didn't take the blood at 7 a.m., right? That's kind of, I don't know, where's the line of like, when do you do a new entry versus including it with this? I kind of think like every entry is kind of like, what did we do in this half an hour? And then the next addendum would be from there, what's happened since then. And the next addendum from there, what's happened since then, kind of thing. Hope that makes sense. So blood draw information is important, and then when you get the blood, that's another thing. Sometimes you have the blood draw in your morning soap, no problem, and then you put the interpretation there. Did you have the interpretation at 7:30 in the morning when you did your morning? No, you did not. So that just doesn't look very realistic. I know that's a small thing, but just put an addendum, and like it's 2 p.m., that's when you got the blood information. If there's a problem and you can't get your information, we can't get the information, because I'm at home looking at this at 5 saying, why is there no blood work interpretation, right? Why didn't you do it? So if you can't get it, no problem, just say you couldn't get it for some reason. The system was down. We weren't able to take blood and we're going to have to do quats tomorrow, whatever it is. So just explain what's happening, because I'm not there in person. Do I even have any other comments? I don't think so. Okay, so the final thing I'm going to say that does happen, and feel free after that, like I'll stick around for questions for a bit, or if you have any questions, no problem. A lot of times the morning, Thursday morning, you do a great morning soap, and then you have a whole lot of stuff happening, right? I get it, and it's stressful. This semester I get to be there 8 times, so I will actually get to see you in person. And I hear I'm very animated in junior surgery, so we can look forward to a great circus. Anyway, I mime a lot and also make loud noises, and at any time any of you can say, please be quiet, I need to focus. That is fine. My feelings will not be hurt. Thursday morning, you do your morning soap. Bunch of stuff happens. You got a lot of forms, you got your anesthetic sheets, got to write your surgery reports, all that stuff. Sometimes the addendum in the medical record is then, say, 1:30, and it says, QAR in kennel, and it gives me a TPR. Check again in an hour. And I'm like, what happened between 7:30 and 1? Like, you didn't even tell me if the animal had its surgery or not. Now, I don't want to hear that you, what am I trying to say? I don't want to hear pre-medicated at 7:15 with this mg per kg dose of hydromorphone and dexmedetomidine in the right rear leg. I am in the quadriceps muscle. 15 minutes later, we place a catheter. Blah, blah. All of that is in your anesthetic record that Dr. Hamilton will look at. So everything from pre-med to extubation is recorded elsewhere. But at extubation, there's things that happen like giving an NSAID. That might also be on your anesthetic record, but that's kind of where I'm drawing the line. And I would love to hear in that addendum, your first addendum after your animal is recovering, what happened in broad strokes. So an example would be at an addendum. Let's pretend this is Thursday and it's 1:30, what did I say? Okay, 1:20, sure, 1:20 p.m. So you could say P is resting comfortably post-surgery. Oh, there's a clue. It got surgery. Okay, now at least I know. Okay, post-surgery. Then you could say castration was uneventful. You could even say see surgery report for details. Then you could say like patient was extubated. Sorry, I'm gonna rush here because I want you guys to have a nice break. So you'll do the typos later, okay? A patient was extubated at, let's say, 12:20, and CPR was blah, 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 blah. And then you would give me some Medicam information, right? So I'm just gonna put Medicam info there. Okay, let's go down a little bit here. If there was stuff that wasn't uneventful, maybe you list it, or like, typical cat spay was, you could say ovaries and uterus were removed. The pedicle was dropped and approximately this much blood was lost. That would be something important to note, right? Okay, so broad strokes. You don't have to tell me every little scalpel incision or what you used for suture or anything like that. That's elsewhere. But you can't just say they're resting comfortably. I don't know what happened. So tell me a little bit about what happened, and then this would be a really good point to not just say how the animal is, but this is an important part where you're planning very much every hour what's going to happen, right? So you're going to say the Medicam and then say how you're following up with that. I understand your Medicam injection is only going to be given once, but I would love to hear the story of how you're planning to address post-operative pain. So I want to hear, what is your plan for NSAIDs? And that's not just one, it could be just one injection, if it was a cat neuter maybe, but it's probably not in this case. So I'd like to hear, what is your plan for NSAIDs? What is my plan for any other type of post-op medication? You could say continuing with gabapentin, that's valid. I already know you are, unless you made a change. What are your opioid choices that you're going to be using? How often do you plan on giving them? And I know that you have, it's all set up, so it's just like, we're going to assess it at 4 and give it. But that doesn't tell me that you understand how often are opioids actually given. What is the dosing interval? So if you actually say, hydro was given, last hydro dose was this, and then actually say the prescription information that I asked for, and we normally give hydromorphone every 4 to 6 hours, post-op, and then you could be like, plan to assess at 4 p.m. and we'll decide then. Does that make sense? So a story about what happened would be important. I don't think I have anything else that's that great to say, so sorry that I'm a couple minutes over. Let's have a 10-minute break, I guess, and then Dr. Hamilton will be back. Happy to have questions if you think there's stuff that's really important. Any questions you think are super important for everybody? Or is it just a... Go ahead.
Will there be a copy of this on Google, like the blank medical record with like the comments and stuff?
Well, there definitely will be a video recording, but sure, I'll load it. Maybe I'll put a few more things in. Maybe I'll even fill it out as an example. Now, I know you have examples already. I don't really like your examples that you have for medical records. I don't think they're the greatest. And I'm kind of like, well, maybe they are good examples because it tells you what not to do. And I definitely have commented on that in the past. Sorry, let's stop there. But they're not like junior surgery examples, right? They're like a sick animal or something, I think. Pretty sure. I will look into it, and I will get you all the help that you need. Anything else? Okay, feel free to come down and talk to me, and I'll see if I can get the computer back. Okay.